So thank you for the introduction. I'm Lucy. I'm one of the genetic counsellors working in the Belfast Trust. So some of you may know me from clinic. I've been there for the past 2 years. So this is kind of a map of where we do clinics. We're based in the City Hospital, but we do satellite clinics, sort of different parts of Northern Ireland. We do have a big gap, kind of Omagh, Cookstown and Gannon, which we're trying to address, but we're happy to see people kind of where suits them best. We generally accept referrals from the GP, so most of our referrals will come that way, but we do have particularly symptomatic people coming through neurology or other services. So this is just a bit about our role. We do work we've got training in genetics and counselling. We're not psychological therapists. We can only sort of provide a certain amount of psychological support, but we do refer to other agencies. And what we do is we interpret family histories, so medical histories, family histories, we assess risk and we communicate genetic information. And we also help with decision making. So we want to help all our patients make informed choices about their genetic testing, screening and ongoing management, and also sort of incorporate their values and circumstances. So everyone's got a different reason for coming for testing. Some people just want a chat, which is absolutely fine. And we also support people, to cope with new diagnosis, because it's a difficult thing to sort of get a diagnosis, and we don't want to just send people on at that point. We do want to support them. So we work across 4 main areas. A lot of our referrals are for cancer. We also get, so many different genetic conditions that we see. We work in prenatal genetics and also neurodegenerative conditions. So some of you might have seen this before if you've been through the testing process. This is the pathway that we use, and it's used across the whole of the UK and also other countries. So what happens when you're referred is we triage you to a face-to-face appointment. We like to see people face-to-face in the first instance, generally at one of the satellite clinics, whichever suits best. And you'll have an appointment with someone like myself or one of my colleagues or another genetic counsellor. If you want to proceed to the second appointment, that would be with a genetic counsellor and a consultant, and that would generally be done in Belfast City Hospital. And we're happy to also sort of arrange other appointments between that. So if somebody's had 2 appointments and doesn't feel like they're ready to make a decision, we're more than happy to do a third appointment at that point. And then we also like to see people face to face for our results. So that would be with the genetic counsellor, the same genetic counsellor you've seen previously, and also the consultant. And then we also follow up with a phone call kind of a couple of weeks after getting your results. So the first appointment, generally these are the sort of main things we discuss. So family history is a big one. We're discussing, what your knowledge is of the family history, how much exposure you've had to the condition, how long you've been aware of it in the family. Health history as well. So, physical health and mental health are both equally as important. If anyone's symptomatic, sort of make a note of that. If you've noticed any changes in your health over the years that could be related. And we also talk about the condition, so the genetics of the condition, the symptoms, what sort of treatments are currently available. A big thing is motivations for testing as well, so that's something we do like people to think about, because it's a big thing deciding to go through predictive testing for Huntington's disease. So, you want to think about what your motivations are. For a lot of people, it's just sort of removing uncertainty, planning for the future, reproductive planning. They're sort of the main motivations. We also talk a bit about insurance, so insurance implications of testing, and support network. So that's a big thing for people who are having testing. You want to make sure you've got a good support network. Having somebody who's aware of what you're going through is always really important. And some of you might have seen this before as well. These are 2 sort of sheets that we would give you at the first appointment. It's not to gatekeep, and it's certainly not, we don't review these and say, this person shouldn't be tested. It's really just to get people to start thinking about, why they're coming forward for testing at this time, and getting them to think about the different aspects of it. And the second appointment with the genetic counsellor and the consultant can do a physical examination. Oftentimes people aren't symptomatic at the point of testing, so it wouldn't really show much, and it wouldn't tell us much about kind of what we'd expect the result to be. But it could be good just to sort of, if the physical examination is normal, you'd expect, even with a positive result, that they'd be fine for a certain number of years. There wouldn't be any symptoms expected. And at this point as well, we get people to sort of reflect on, is it the right time for testing? Sort of reflecting on what's been discussed in the first appointment, and how they've sort of felt from that first appointment until the second one. And at this point as well, this is when a lot of people would provide a sample for testing, and then also planning for the communication of results. So we do like to have, we encourage people to bring somebody with them, ideally somebody who's not also at risk of Huntington's disease themselves, someone who just would be a good source of support, at that results appointment and thereafter. And then results are communicated usually a couple of months later, and in the follow-up phone call just to check in, because even with a negative result, you'd expect people would be, it would be great, but for a lot of people there is things like survivor guilt, and they lose a bit of their identity effectively. If they find out they're not expected to develop Huntington's disease, so it can evoke sort of unexpected feelings. So it is really important. We do place a lot of focus on the importance of timing. As many of you know, the implications of a positive result can be really, really difficult, and it can trigger intense emotions. We also like people to think about the timing. We don't want pressures from like family members or outside pressures. Wouldn't be ideal. It's actually just really important that the person makes the right decision for themselves. So time for thoughtful reflection, and also so they feel empowered in their decision making, because they really do need to sort of understand the implications of both results. And also life stage considerations. So if somebody's going through a big transition, such as leaving school, going to university, that's a big thing that might not be an ideal time to find out such life-changing information. Career planning, relationships, and also family planning. And a lot of people who come through us for testing don't actually decide to test at that time. So about 70% of people in the UK who have the pre-test counselling, have 2 appointments, decide at that point it's not right. And that's not a waste of anybody's time. We're more than happy to see people however many times they feel they need. And at that point, if they decide, testing is not the right thing, that's not a waste of anybody's time. And only about 15 to 20% of at-risk individuals take up testing. And the most common reported motivation is to reduce uncertainty. So we also, after we've given somebody a diagnosis of Huntington's disease, we're more than happy to see them again for, even just follow-up. But a common reason that people would come back to us is for reproductive planning. So for a lot of people who tested several years ago, there weren't really options for reproductive planning, and that has changed, in the past 10 years. So during pregnancy, we can provide information about reproductive options and support decisions that incorporate people's beliefs and values and motivations, and also address the emotional and psychological needs either preconceptually or during pregnancy. And we also often make referrals to other agencies like fetal medicine. If somebody's wanting to have testing during pregnancy to see if the baby's inherited Huntington's disease, that would be a common sort of referral we would make. And we also would support people, throughout that process. So, if somebody decided that they were just, testing wasn't appropriate during that pregnancy, we can provide information for future reproductive options. So a fairly new technique is pre-implantation genetic testing. So it's a type of IVF with an added step of genetic testing. So the genetic testing of the embryos, everything's sort of the same as the IVF. So the woman or the partner that's hoping to become pregnant takes the hormones and goes through the IVF process. At the point of the embryos being a few days old, they'll take a few cells from that and test to see if the embryos have inherited a condition, such as Huntington's disease. And only those embryos that have not inherited the condition are considered suitable to reimplant back into the womb in the hope that a pregnancy results. It's a difficult process, and approximately 1/3 of couples will have a successful pregnancy after each cycle. So the success rate is not massively high. It is increasing, but a large proportion of people who go through this don't actually have a pregnancy that's successful in the end. So it's a lengthy process, and it can be complex. So on average, it could take 8 to 18 months, for the PGT, and obviously there's 9 months of pregnancy on top of that. And there's complexities as well, depending on the individual. It's physically and emotionally demanding, as IVF is. It's not easy on particularly the partner who's hoping to become pregnant, and for some people, obviously going through a couple of cycles and having no success would be a really, really difficult thing to cope with. And there is no guarantee. So we have a lot of couples who've gone through this and have had successful pregnancies, where they can be certain that the baby's not inherited Huntington's. But on the other side, we do have couples who've gone through several cycles and haven't had success. So it is difficult. And it's also not offered locally, so we do refer people to Guy's and St Thomas in London and Birmingham Women's Hospital. So it is fully funded, and travel and things would be funded, and the PGT would be funded. But there is quite a strict eligibility criteria, which must be met at the time of referral, so there's sort of no wiggle room here. So this is the current eligibility criteria, and it does change over time. But the female partner must be under 40 years of age when the treatment starts. So if we have somebody coming to us at age 39, we do have to be upfront and honest about the fact that they could potentially get one cycle, but if that's not successful, they wouldn't be funded for another cycle. BMI must be greater than 19 and less than 30, and both partners must be non-smokers. Testing for the condition occurred in an accredited genetics laboratory, which is generally everybody meets that, and the couple must be in a relationship for at least 1 year. If you were to Google PGT eligibility criteria, this bottom one would also be listed. It's not currently applicable in Northern Ireland, so we do fund for as many cycles as people want or need. Obviously there's only so many cycles that people could go through in a limited amount of time. So PGT is quite a common referral that we make. You don't have to have testing for that, so a lot of people would come to us and they'd be kind of conflicted about whether or not it's the right time to test and whether or not they want to know their HD status. We can, for many couples, refer them on for this process without actually testing. So it's a type of PGT called exclusion testing. So if we've got the parent, which is in the middle generation, is hoping to have a child, and they know that one of their parents has got Huntington's disease, it's the type of testing where they would basically only implant the embryos that have not inherited a copy of the gene from the affected grandparent. So we don't know which one of the affected grandparents' genes are affected with Huntington's disease. So they would just make sure that any of the embryos that are implanted have got none of the HD gene from the affected grandparent. So it's quite useful for people who, don't necessarily want to find out whether or not they're going to develop Huntington's disease at that time, but can still sort of avail of this type of, PGT. So there are other types of prenatal testing for people who become pregnant naturally and want to find out if the baby's inherited Huntington's disease. So two that are currently available is chorionic villus sampling and amniocentesis. So they would be offered during pregnancy. They are invasive tests, and they are accurate tests. It does increase the risk of miscarriage slightly by about 1%, but it's certainly it's an accurate test for people who are keen to find out during pregnancy to incorporate that information into decision making. So if somebody's falls pregnant and they know that they've inherited Huntington's disease, we would encourage them to get in contact with us quite quickly because these options are only available for a limited time. So the first one is between 11 to 14 weeks of pregnancy, and the second is between 15 and 20 weeks of pregnancy. So if somebody comes to us kind of at 19 weeks pregnant and says, I want to have this test, you are quite limited in time. So we do encourage people to sort of get in contact with us quite early if it's something they want to consider. Another type of testing which is not currently available for Huntington's disease, but it might change, in the next couple of years, is a non-invasive type of testing. So it's taking a blood sample from the mother and testing because the baby's DNA is within the mother's blood sample. So it doesn't increase the risk of miscarriage. And it's not currently available, but it's something that we are hopeful will be in the future. It's quite a good option because it doesn't have that increased miscarriage rate. So just a few websites to signpost to. So the first one is our website. There's information about different types of prenatal testing. Everything's NHS funded. So our email address is on there as well, and our contact number. If somebody was pregnant, we would encourage them just to get directly in contact with us to discuss the options as opposed to going through the GP, because you are a bit more limited for time. And on our website, we've got different drop downs with different information, some of which would be relevant to somebody with Huntington's who was hoping to have testing during pregnancy or PGT beforehand. Guy's and St Thomas, where we refer people for PGT, they've got a lot of information on their website about PGT. They've got stories from families who've been through it and had a great experience, which is sometimes nice to read because it's not all. We do it's important for us to make people aware of the success rate because we don't want to give people false hope, but it is also nice to read the testimonies from families who've been through it. And then Antenatal Results and Choices, ARC, is a really great charity for people who would like to discuss sort of reproductive options and get support. We refer people there a lot, and they've got some really nice information on their website, so definitely contacting us in the first instance if somebody's wanting to discuss reproductive options, but there's also good support through them as well. So I think that's me. I'm happy to answer any questions now or at the tables this afternoon if anybody's got anything to ask. Sorry, hold on.